Hypopituitarism. Definition. Hypopituitarism is the decreased, hypo, secretion of one or more of the 8 hormones normally produced by the pituitary gland at the base of the brain. If there is decreased secretion of one specific pituitary hormone, the condition is known as selective hypopituitarism. If there is decreased secretion of most or all pituitary hormones, the term panhypopituitarism, pan meaning all, is used. Signs and symptoms.
Growth hormone, GH, deficiency. In children, GH deficiency may cause growth problems and short stature. Most adults who have GH deficiency don't have any symptoms, but for some adults it can cause fatigue, muscle weakness, changes in body fat composition, lack of ambition, social isolation, luteinizing hormone, LH, and follicle-stimulating hormone, FSH, deficiency. Deficiency of these hormones, called gonadotropins, affect the reproductive system. In women, the deficiency decreases egg and estrogens production from the ovaries. In men, the deficiency decreases sperm and testosterone production from the testicles. Women and men may experience a lower sex drive, infertility or fatigue. In children and adolescents, delayed puberty is usually the only symptom. Women may also have symptoms such as hot flashes, irregular or no periods, loss of pubic hair, an inability to produce milk for breastfeeding. Men may also have symptoms such as erectile dysfunction, decreased facial or body hair, mood changes, thyroid-stimulating hormone, TSH, deficiency. This hormone controls the thyroid gland. A TSH deficiency leads to low levels of thyroid hormones, hypothyroidism. This causes symptoms such as fatigue, weight gain, dry skin, constipation, sensitivity to cold or difficulty staying warm, adrenocorticotropic hormone, ACTH, deficiency. This hormone helps adrenal glands work properly and helps body react to stress. Symptoms of ACTH deficiency include severe fatigue, low blood pressure, which may lead to fainting, frequent and prolonged infections, nausea, vomiting or abdominal pain, confusion. Prolactin deficiency. Prolactin is the hormone that tells the body when to start making breast milk. Low levels of prolactin can cause women to have problems making milk for breastfeeding. Antidiuretic hormone, ADH, deficiency. This hormone, which is also called vasopressin, helps body balance its fluid levels. An ADH deficiency can cause a disorder called diabetes insipidus, which can cause excessive urination, extreme thirst, electrolyte imbalances.
Oxytocin, OXT, deficiency. It generally causes few symptoms, as it is only required at the time of childbirth and breastfeeding. Causes.
Type. Causes. Tumors. Most cases of hypopituitarism are due to pituitary adenomas compressing the normal tissue in the gland, and rarely other brain tumors outside the gland, craniopharyngioma, meningioma, chordoma, ependymoma, glioma or metastasis from cancer elsewhere in the body. Infection, inflammation and infiltration. The pituitary may also be affected by infections of the brain abscess, meningitis, encephalitis, or of the gland itself, or it may be infiltrated by abnormal cells, neurosarcoidosis, histiocytosis, or excessive iron, hemochromatosis. Empty cellar syndrome is unexplained disappearance of pituitary tissue, probably due to outside pressure. Autoimmune or lymphocytic hypophysitis occurs when the immune system directly attacks the pituitary. Vascular. As a pregnancy comes to term, a pregnant woman's pituitary gland is vulnerable to low blood pressure, such as may result from hemorrhage. Pituitary damage due to bleeding after childbirth is called Sheehan's syndrome. Pituitary apoplexy is hemorrhage or infarction, loss of blood supply, of the pituitary. Other forms of stroke are increasingly recognized as the cause for hypopituitarism. Radiation. Radiation-induced hypopituitarism mainly affects growth hormone and gonadal hormones. In contrast, adrenocorticotropic hormone, ACTH, and thyroid-stimulating hormone, TSH, deficiencies are the least common among people with radiation-induced hypopituitarism. Changes in prolactin secretion is usually mild, and vasopressin deficiency appears to be very rare as a consequence of radiation. Other physical. External physical causes for hypopituitarism include traumatic brain injury, subarachnoid hemorrhage, neurosurgery and ionizing radiation, e.g. radiation therapy for a previous brain tumor. Congenital. Congenital hypopituitarism, present at birth, may be the result of complications around delivery, or may be the result of insufficient development, hypoplasia, of the gland, sometimes in the context of specific genetic abnormalities. Mutations may cause either insufficient development of the gland or decreased function. Forms of combined pituitary hormone deficiency, CPHD, include type OMIM gene CPHD1 6,13,038 POU1F1 CPHD2 2,62,600 PROP1 CPHD3 6,577 LHX3 CPHD4 6,02,146 LHX4 CPHD5 septo-optic dysplasia 1,82,230 HESX1 Kallmann syndrome causes deficiency of the gonadotropins only. Bardet-Biedl syndrome and Prader-Willi syndrome have been associated with pituitary hormone deficiencies.
Diagnosis.
If the doctor suspects a problem with pituitary hormones, he or she will likely order several tests to check hormone levels in body and search for a cause. The doctor may order tests including blood tests. These tests measure hormone levels. For example, blood tests can identify low levels of thyroid, adrenal or sex hormones. The tests can determine if these low levels are associated with pituitary hormone production. Urine test for pituitary hormone. Stimulation or dynamic testing. These tests also measure hormone levels. The doctor may suggest that client goes to a clinic that specializes in endocrine conditions for these tests. These tests check body's hormone levels after taking certain medications to stimulate hormone production. Brain imaging. Magnetic resonance imaging, MRI, or high-resolution computerized tomography, CT, of brain can detect a pituitary tumor or other pituitary gland problems. Vision tests. These tests can determine if growth of a pituitary tumor has impaired sight or visual fields. Other tests may include brain CT scan, pituitary MRI, ACTH, cortisol, estradiol, estrogen, follicle stimulating hormone, FSH, insulin-like growth factor 1, IGF-1, luteinizing hormone, LH, testosterone level, thyroid stimulating hormone, TSH, thyroid hormone, T4, biopsy of the pituitary, osmolality tests for blood and urine.
Management. Treatment of hypopituitarism is threefold: removing the underlying cause, treating the hormone deficiencies, and addressing any other repercussions that arise from the hormone deficiencies. Underlying cause. Pituitary tumors require treatment when they are causing specific symptoms, such as headaches, visual field defects or excessive hormone secretion. Transsphenoidal surgery, removal of the tumor by an operation through the nose and the sphenoidal sinuses, may, apart from addressing symptoms related to the tumor, also improve pituitary function, although the gland is sometimes damaged further as a result of the surgery. When the tumor is removed by craniotomy, opening the skull, recovery is less likely, but sometimes this is the only suitable way to approach the tumor. After surgery, it may take some time for hormone levels to change significantly. Retesting the pituitary hormone levels is therefore performed 2 to 3 months later. Prolactinemas may respond to dopamine agonist treatment, medication that mimics the action of dopamine on the lactotrope cells, usually bromocriptine or cabergoline. This approach may improve pituitary hormone secretion in more than half the cases, and make supplementary treatment unnecessary. Other specific underlying causes are treated as normally. For example, hemochromatosis is treated by venesection, the regular removal of a fixed amount of blood. Eventually, this decreases the iron levels in the body and improves the function of the organs in which iron has accumulated. Hormone replacement.
Hormone replacement medications may include corticosteroids. These drugs, such as hydrocortisone, Cortef, or prednisone, Rayos, replace the adrenal hormones that aren't being produced because of an adrenocorticotropic hormone, ACTH, deficiency. You take them by mouth. Levothyroxine, Levoquil, Synthroid, others. This medication treats the low thyroid hormone levels, hypothyroidism, that a thyroid-stimulating hormone, TSH, deficiency can cause. Sex hormones. These include testosterone in men and estrogen or a combination of estrogen and progesterone in women. Testosterone is administered either by injection or through the skin with a patch or a gel. Female hormone replacement can be administered with pills, gels or patches. Growth hormone. Also called somatropin, genotropin, humatrope, others, growth hormone is administered through an injection beneath your skin. It promotes growth, which helps produce a more normal height in children. Adults with symptoms of growth hormone deficiency also may benefit from growth hormone replacement, but they won't grow taller. Fertility hormones. If you have become infertile, gonadotropins can be administered by injection to stimulate ovulation in women and sperm production in men. Complications. Complications of hypopituitarism include visual deficits and, due to a limited ability of the endocrine system to respond appropriately, susceptibility to infection and other stressors. Decreased quality of life has been documented by standardized questionnaires.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.